Hello, everybody. My name is Adewale. Welcome to our Health Talk. Welcome to the show. Today, welcome to the show. I'm waiting for Dr. Osas. I'm waiting for him. I'm waiting for him. I'm waiting for him. Please, Dr. Osas, if you are there, please send me a request. Dr. Osas, if you are there, please send me a request. I'm waiting for Dr. Osas. Okay, thank you very much. Thank you. You can send me a request. I will accept it. Okay, thank you. Okay, thank you, sir. Please, you can share it here.
Okay, so I guess you can see me now.
Yes, I can see you, doctor.
Okay, yeah, sorry. Good evening.
Good evening, my friend, doctor. How are you?
I'm fine. Can you hear me clearly?
Yes, I can hear you very clear.
Okay. I don't
Good
do
to
this
see you and good to
program.
have you on the show.
Yeah, it's been a very long time, is it? It's
Very long.
been a very long time. Uh,
Thank you very much.
yeah, I'm seeing some of my colleagues joining on the show. I'm interested.
Wow. Okay, I would like to. Do you want me to bring any one of them on?
No, it's fine. They are shy. They won't come up, but it's fine.
Why? Why? Please come on. We want to learn from you guys. Want to learn from you.
No worries, it's fine.
Please
I
send
hope
me a
anyway.
request if you want to come online, please.
Okay, thank you. This is
Okay.
fine. Okay, so I think we are starting almost immediately, are we?
Yeah. Before we start, Dr. Osas is my friend. He's a very good friend of mine. I respect him. I do not take this opportunity for granted. I love you. Thank you for your support. Thank you for how you accept the invitation. Please follow us on Instagram, The Voice. We talk on everything, anything that is good, any content that is good. Visit our website www.devoice normal voice 12, and not only that one, visit our Twitter handle, visit our YouTube channel the voice 12. We have a lot of content. We are coming out with a lot of content, not only on politics. We talk on everything that is related to life, and I pray God will help us. The floor to you. You want the floor now, doctor. Good to see you.
Okay, thank you very much, Kaga. So I think the topic is quite common, but I will be very brief and I'll try and be very
Doctor, please can you make your screen so that, because I'm putting this thing straight to YouTube. Yeah, I would like it like
okay.
that, sir.
Can you hear me? Can you see me clearly now? Is it
Yes, I
better
can
now?
see you very well. Yeah.
Okay, so the just a minute. Okay, just a minute to think. 1 minute, please. All right, so I'll just talk briefly on just yeah, good. So I'll just talk briefly on hypertension and some of the myths that are associated with hypertension, particularly in Africa, Nigeria to be precise. I know that once you if you go out there in the hospitals around, you keep hearing hypertension, IBP. You know, I remember practicing somewhere and people will ask, if I ask them, are they treating you for any medical condition? And the people will say, oh, doctor, the talk say I get IBP. Sorry, I probably will use pigeon as well in this conversation because I feel
Yes,
that.
you're welcome. You're welcome. We are welcome. You're welcome. I like that.
Okay. All right, so a lot of people would say, doctor, the talk say I get IBP, just like diabetes. They'll say, oh, doctor, they say I get high sugar. So hypertension is indeed out there, and it's something, if we don't keep talking about it, changes will not be made. So I'll just go briefly with the definition. Now, hypertension, as it states, is elevated blood pressure. That is when your BPD high, where. Now, many things can cause your blood pressure to be high. But in the case of hypertension, it is when we have done the readings like twice. Maybe I did it now and I did it tomorrow, and it's persistently high. That is hypertension. Or I do it 6 hours apart. Am I making sense? Then other things, if I run from here, maybe I run to the market and come back, it can cause my blood pressure to be high. But that does not mean I have hypertension. But I have hypertension when you consistently check my blood pressure and it's always high. And it's indeed out there in Nigeria. And there are many causes. But I would want to give us the values. Now, when we check hypertension, the values of your blood pressure usually should be less than, there's the one on top and there's the one under. The one on top is what we call systolic. The one under is what we call diastolic. So the one on top should be less than 140, while the one under should actually be less than 80. So if it is now higher than that on two different occasions, then you are turning towards hypertension. Am I make sense? So that's like the basic definition of hypertension. So don't say because you go to the clinic today and you check it, you just say, doctor talk, say, you check your blood pressure, it was 160. You were running, you were under the sun. Your blood pressure would go up. But when it's done at rest and everything. So the thing is, there are several causes. And being in Africa, Africa is a major seat for some type of hypertension. I will talk about that in this discourse. So as I was saying, there are several causes. But common to us in Africa is the fact that there's what we call primary hypertension. So generally, we have primary and we have secondary. Primary is the one we don't know the cause, while secondary, we know the cause. Am I making sense? So I'm going to be very pleased if you don't understand, just explain. So primary is we usually don't know the cause, but funny enough, there have been some theories to say that this could possibly be the cause for primary hypertension. And I'll give us an example. And all of us, including myself, we are all culprit of this. It's commonly said that the reason why primary hypertension is common in Africa is because of the fact that we overwork our kidneys. Normally, the kidneys help to regulate, it secretes some stuff that will help to regulate blood pressure, particularly when there's low blood or low volume in our body. We Africans are blessed we are. We used to overstress our kidneys. So this causes the kidney to persistently secrete or produce those chemicals that continually try to maintain the blood pressure. And in doing that, we are going to have hypertension. That's why whenever I'm seeing a patient, my appeal to them is please ensure you drink water. Because trust me, Africans don't drink water. You know, it's actually advised that you drink close to 2,300 mils of water a day. When you mean 2,300 mils of water, that's like 2.3 liters. If I ask you, when did you drink water? You tell me I drank one pure water when I wanted to eat breakfast. I drank one pure water when I wanted to eat lunch and dinner. Now look at it. One pure water is 50 cl. Abi? Or some will even say 60 cl. That means you are taking 150 cl in the morning, afternoon, and evening. That's like 1.5, yeah? Look at the deficits. 2,300 minus 1,500. So you see that you are not doing yourself any good. So please, if there's anything you've taken from me in this discourse, ensure you drink water. It's a gift. I mean, my colleagues...
Let me go and look for one bottle of water. Doctor, go ahead.
All right, so as I was saying, my colleagues would surely agree with me that there are people who usually regulate the water they drink. I mean, there are complicated cases where you now have to say, please, you don't need to drink water. Those are people whose kidneys are already, I mean, they have a chronic kidney disease, and you need to measure the amount of water they drink and the amount of water that goes. So it goes on and on and on. So I've just talked about primary hypertension. Other causes of hypertension could also include, I mean, there are many causes. You are doing well. I hope Aquafina is going to give you advice, but this day you're advertising them.
Okay, Bro, I don't take water. I don't take water like that.
But
now, I'll be taking
it's important we do that. So back to the discourse. So as I said, I'm talking about the causes. I've talked about the fact that primary, the cause is unknown, but they are speculation. And I just gave an instance of one of the speculation. So I'm not saying that that's the cause, but it's been speculated. But it's not like, but I mean, it stands to reason. Other causes could be hormonal. When you mean hormone are chemicals secreted from different parts of our body. I mean, some specialized part of our body. And when these are secreted at a very high, normally, God is so wonderful that there's a balance. When there's stress, it's produced. When there's less stress, it's not produced. So when these hormones are produced, the more it can actually cause hypertension. That's why people will now start telling you so many conditions. We have when there's this special gland in our neck, very special structure. When it comes out, excess of it can cause hypertension. That's called hyperthyroidism. Then there are other conditions that, I mean, it's not common to Africa. There's where there's a way the body is structured that there are a lot of pipes, and the pipes are veins and arteries. There are times when the pipes are very tiny. There are times when the pipes become big. These are several factors of hypertension. Now, there's one thing I need to mention here. You could Google it. Everybody could Google it. They'll say overthinking is causing hypertension. No, it doesn't cause hypertension. There is no paper. I mean, there is no paper. You just have hypertension because there are risk factors. But I'll talk about the risk factors. You understand? But overthinking is not like a cause. But I'm not saying you should overthinking. Overthinking is not good. I mean, one of the songwriters, I think he said, overthinking not the cause for probability. I don't know how he said it. But the point I'm raising is, it's not like it's, see, if I overthink, I can't go, yo, doctor, because I do overthink, I think, hey, no. You are just thinking, deceiving yourself. It's not true. Do you understand? There are papers to actually show that it can only cause your blood pressure to increase for a while and it come down. See, the topic of hypertension is quite inexhaustible, but I'll just try and summarize it. So I was going to talk about the risk factors about hypertension, which is very important in this discussion. Number one, being of African descent is a risk factor. So the thing I appeal to people is that we are Africans itself is a risk factor to some condition. So also here in other parts of the world, that they are where they are is a risk factor to some disease condition. But don't put yourself at that point where the disease can easily come. That's why I'll still advise you to drink water. Am I making sense?
I'll be trying to take like maybe 7. How many bottles of this one I will be taking per day now?
I don't know. I think it's like 75 cl. So, I mean, it's about 75 cl. I can't really remember. So you should do the calculation. 75.
How
But you should know that.
Pure water, how many?
Pure water is 50 cl. So
Yeah.
that's like, it's not to 500 ml. That's like 1.5 liters if you take 3 pure waters. So you're supposed to take like 4 or 5
Per day. Don't worry.
Yeah,
I'll take
minimum.
7.
And your kidney will be happy for it. Trust me. Your kidney would want to give you a high five. You say, "Oh, guy, you're doing well." All right. So back to the discourse. I was talking about the risk factors. Number one risk factor is African descent. Number 2 is family history. So if you have someone in your family that has had hypertension, it increases the risk of you having hypertension. Do you understand? Other risk factors could include obesity. Now, obesity is not when I wake up in the morning and I say, today I am fat. No, that's not obesity. I mean, you could probably give a subjective view of obesity. You would the reason say you fat, but you never fat because you need to confirm whether you're actually fat. And that brings me to a common thing that is done on arrival in the hospital, your BMI. That's the body mass index. But that's not something we'll be discussing today, but just for you to know. Do you understand? The objective way of checking if you are actually under.
Yes, I can hear you. The network is frustrating. But go ahead, sir.
Oh, okay. All right, good. So obesity, you need to objectively measure it. It's not like I think say I fat or it be like say I fat. Mm-mm. How do you measure it? When everyone is free outside this discourse, you can check your weight and your weight over your height, but your height in meters. Now, let me give you an example. My weight currently, I think I checked my weight, it's about 69. I'm 69 kg, and my height is about 178 centimeters. In meters, it's 1.78. So you are going to calculate your weight over your height squared. Then, if it is greater than 25, you're obese. That is like the objective way. Then there are other grades, but I mean, I just want to give you an insight to that. So that's why, just in case I forget, please ensure you watch your diet. These are risk factors to having hypertension. So I've talked about family history. I've talked about family history. I've talked about African descent. Another risk factor for hypertension is also age. As one ages, the blood vessels, the pipes in the body become thickened. So which now increases the stress on the heart. And when you do that, it's indeed will stress the body. And indeed we overwork the heart, and indeed we increase blood pressure. Am I making sense? So these are risk factors. Then generally, the question now is, what do we do? First of all, please, if you are told that you have hypertension, it's not a death sentence. I'll talk about the complications of hypertension, but it's not a death sentence. And if you have, please, you need to see the doctor. Now, let me just give you insight to what are the symptoms of patients that have hypertension. What will I have in my body that will make me say, it like I get hypertension, it like I not get hypertension? Number one, most people walking the streets of Nigeria don't know they have hypertension. So we say it's asymptomatic, meaning the person can just be without any symptom. I remember vividly when I was practicing medicine somewhere in one of the villages in Edo State, I had a patient that she just came to greet somebody who just gave birth. And she now said, doctor, make I just check my blood pressure. And her blood pressure was reading 180 over 140. I had to say, madam, calm down. I need to check it again. It was still reading that high. She didn't know. She doesn't have headache. She doesn't have body pain. She doesn't have tummy pain. She doesn't have chest pain. She doesn't have anything. But she had hypertension. So most of the patients usually will present without symptom. So it's usually, I dey waka for road, I just fall down. Patient. So usually people will present to the hospital with complications, which I'll be talking about in the next couple of minutes. You understand? And I'll be open to questions, hopefully. I'll be able to answer some questions. So, but back to the,
Yes, please,
to
if you
the
have your
talk.
question,
So,
you can send it. You can write it and send it on the wall. I will be jotting it down now.
okay. So as I was saying, the thing now is, what are the presentation? Some will not present. To those that now have symptoms, that have the manifestations of hypertension, commonly they have headache. Or that they will have headache. Please, I'm not saying all headache is hypertension. No, don't quote me wrong. But one of the commonest symptoms could also be hypertension. I don't know where you get what I mean. Then others could include chest pain, cough. I mean, these could be symptoms, myriad of symptoms. And it could even be like normal malaria, like the next day, just generalized body weakness. These could be symptoms. And it could also be symptoms of the condition that is causing the hypertension. Like there are some kidney diseases that can cause hypertension. When the blood vessels, the pipes in the kidneys, when they are very tiny, overworking the kidneys, that one could also cause hypertension. I mean, it's though quite rare in Africa, but it's still there, or probably is underdiagnosed in Nigeria, as I would say. So those are the common symptoms. Then when we examine the patient, we'll now check the blood pressure. It's usually very high. And what can be done? Once you go to see your doctor and your doctor has prescribed antihypertensive for you, please, I beg you, take it. I know that we like neutralizing everything and say it's the witch and everything. Sometimes it's ourselves. The appeal is please ensure you take your medications. There are people who have hypertension and have complications that arise from hypertension, all because they did not adhere to the drugs. And I'll tell you what I'll write in my notes. I'll say patient's hypertension most likely was caused by non-adherence to medication. And I mean, that's what I'm going to write in my medication. Because if I ask you, when last did you take your antihypertensive? I took it 7 days ago, 5 days ago, 10 days ago, and you're not monitoring your blood pressure. Ideally, as you age, I beg people to, I appeal to many people that you should try as much as possible to gather money and buy, at least if it's the battery one, to be checking your blood pressure. And if you are not privileged to have those ones, there are health centers in many of these villages. And in these villages, you could obviously just go to one of the health centers and say, please, I beg, let me check my blood pressure. And whenever you check it, please record it for your doctor. You understand? Sorry, just...
Sorry, it's like show, please. He's coming back online. Sorry for the. He needs to get some sleep.
As I was saying, that's basically bulk of the things as regards the symptoms. Now, how do we prevent it? Which is a major talk in this discourse. Number one is, if you have hypertension,
Sorry, I saw a question. I'm getting a question. I want to write it down. Sorry, from I'll get this. If you want to ask a question, please maybe you should come online. It's like it's finding his network very difficult.
I don't know whether you can hear me clearly now. You should be able to hear me.
Yeah, I can hear you clearly from.
Sorry
It's like
for
are you finding network issues?
No problem. It's fine. I'm back. So, as I was saying, I said that.
Sorry, somebody writes. Doctor, please can you check on the screen? Can you see the question?
Can person build resistance to hypertension? I'm going to answer that question for sure. I would answer that question in the next couple of minutes. So I was saying that.
If you want to ask a question, you can also send the request to me so that I'll put you online. You ask him a question.
All right, that's fine. Yeah, that's good. So the thing about hypertension is, I was going to talk about preventing. So number one, it starts with our lifestyle. First of all, if you have hypertension, it's not a death sentence. There are things you can do. Ensure you take your medications. Then we talk about lifestyle. What are we talking about in the lifestyle? We're talking about your diet. I know that things are hard. Thanks to Buhari, things are very hard. But do you know in its simplicity of your vegetable, that fresh vegetable, honestly, people in the city usually miss the fresh vegetable. I remember working in the village. You just go to one of these village markets, you get sweet, fresh vegetables. Your diet is very important. Avoiding too much of this fried fats would go a long way to save you from the stress of hypertension, or worsening hypertension, as I can say. But the point is, your diet is very important. Ensure you drink a lot of water. Ensure you eat well. When I mean eat well, I know that many of us like shawarma. I know that I'm shaking some tables. But see, please, your life matters to you as much as it matters to your family. Reduce it. Reduce high calorie diets. This can have issues with your blood vessels, and wahala will start. Aside that, exercise. You would see, I used to walk from, for those that know Ibadan very well, you can say I walk from Total Garden to Gates or I work from big. I mean, for those that sorry, I'm using about that. That's the or you maybe for those in Abuja, you say I work from Gwarimpa to Kubwa. For those in Abuja, you get see it's good. You worked from Gwarimpa to Kubwa. You worked from if you're in a boy, maybe you work from Presco to Romchi Park. It's fine. You did, but make it a deliberate act to exercise. Little exercise will go a long way. As long as you sweat, it will help your health. That's very important. Then, aside that, if they give you medications, please ensure you take your medications. Do you understand? So, and if you are being managed for diabetes mellitus, which is one of the risk factors, I forgot to mention it, please take your medications for your diabetes. Diabetes could worsen to become could coexist with hypertension. And please, I when I was working somewhere, I found out that most of my patients were people who are office workers who sit down for 15, 20 hours, not doing anything. I mean, not like doing anything. They are always working on their computer. I like that kind of job as well. But my appeal, please take 2 minutes walk, 3 minutes walk, 4 minutes walk. Because if you don't, you are increasing the risk of having arthritis. Let's leave hypertension. You are having the risk of because you are not using your joints. Because sedentary lifestyle is a risk factor to hypertension. So these are the general things I could add. Now, to the question, can a person be resistant to antihypertensive? There are many medications that can be used to treat hypertension. And do they profile, can someone be resistant? Yes, it's highly likely. However, it's not common. And in the case where it happens, it's usually not what we call a primary hypertension. It's usually a secondary hypertension. I'll take it again. That is, the cause is there. Like patients with some very abnormal blood vessels, like coarctation of aorta, they could be at risk of having antihypertensive resistance. But thankfully, if you can address the aorta issue, the person will feel a lot better. So, can they? Yes, but there's usually a remedy to these things. And do you know there are people that could have been managed with just diet, and they go a long way to I hope I've been able to answer your questions. I don't know whether, so I was going to talk about complications. One of the commonest complications that Nigeria, that is in Africa, is stroke. Stroke is one of the commonest complications for hypertension. It's there. Stroke. If you don't know stroke is when you are unable to move your limbs, your legs. Suddenly, it's very common. Apart from stroke, other complications could also be, it could cause kidney failure. It's common in youths now. For those that don't know, hypertension is common in youth as well. And it can complicate kidney failure. I once lost a 21-year-old guy. He had what we call chronic kidney disease, hypertensive nephropathy. That is the kidney failure as a result of hypertension. We lost him when I was doing my house job then. Do you get? So one of the other complications, so it starts from the head, can cause stroke. In the heart, it can cause heart attack. The one we call heart attack, which is actually called myocardial infarction, is a cause of, it can be caused by hypertension. So hypertension can affect every system in the body. Every system in the body. It can, as I said, stroke. It can even affect the eye. There's what we call hypertensive retinopathy, meaning it's affecting the eye in itself. It could affect, I've talked about the kidneys, it could affect the liver, it could affect anywhere. So please, for what is what, ensure you take care of yourself. Being that we are in the risk factor race for having hypertension, ensure you take care of yourself. And I hope this has helped us briefly. It's just a brief overview of hypertension. I'm not hearing you clearly. I don't know. I can't hear you clearly.
Sorry. I missed myself before. I said, Rabo, please, can you introduce yourself very well? Because you know, because of the time I was thinking, please introduce yourself very well. So the people will not think that maybe I go carry mechanical teach or something. Introduce yourself and tell us the
my
location
name
of where you are.
My name is Kusazoa Igodaro, and yes, I'm a medical doctor. And I'm referring to the Voice channel.
Thank you
Basically,
very
I
much.
think
Yeah,
that's a brief summary of who I am and all.
thank you, thank you. I think you give us the journal. I'll be able to publish it on the website. Please,
Thank
as many
you.
people that are following us, please, people that are viewing it, I see a lot of people viewing it. Please follow me. Go follow us on YouTube and on Instagram. But this episode, by the grace of God, I'm going to post it on our YouTube. Please subscribe. Oh, Dr. Osas, thank you very much. Thank you. God bless you. God bless you. God bless your memory. God bless everything about you. Thank you. I did not take this opportunity for granted. My regards to everybody. My regards to all of your friends and all of your loved ones. I love you. Bye for now.
Thank you very
Or do you
much.
have anything to say
Thank you for
again?
your time. Yeah. Yeah.
Okay, bye bye.